Lira City today is humbled to host the official launch of digitization of Uganda's health supply chain and handover of computers to the districts and health facilities in the northern region.
For some of us who are not aware, we have the biggest challenge in our country is that we as health workers are not recording accurately, completely, the health services that we provide. Now, if we don't document this information, it means we are unable to have stock status, which is the single unit which determines the planning for our country through the Ministry of Health. What should we buy? How much should we buy? Who consumes what? What do we need to supply where? Today, we are moving a notch further, and we are saying the information should be available, should be accessible at all times.
We are transitioning from the use of stock card, where we used to capture information manually, now to the system.
On behalf of USAID funded program, Strengthening Supply Chain Services, with the mission director, we hand over this equipment to the Ministry of Health.
Today, we are witnessing the provision of 95 computers and the accessories to 59 health facilities in the region. In addition, 29 computers will be distributed to 29 district vaccine stores in Lango, Acholi, and West Nile sub-regions to support vaccine management and vaccine programming in the districts. We shall be cascading this to Chigezi and Ankole sub-regions, followed by other regions in the country.
This equipment is part of our continued commitment to digitizing the health sector and to building an integrated digital national health supply chain system.
The system is well coordinated, that whatever is removed from the store, taken to the outpatient, taken to art clinic, taken to maternity or to general ward, can easily be tracked.
The provision of these computers is envisioned to support the following: strengthening government of Uganda's digital health information systems and data governance. 2, improving health commodities inventory, management and ordering through the ERPs, the Enterprise Resource Planning. Improving analysis and reporting of consumption data for essential medicines and health supplies and public health emergency commodities through DHIS2 that all of you know, HMIS Form 5 Section 6, and Pharmaceutical Information Portal. Enabling health workers conduct digital health supply chain self-assessment and improve their supply chain management performance.
For health system strengthening to be successful, we work closely with the Ministry of Health, as well as other development partners, such as the Global Fund and the World Health Organization. We are grateful for the strong partnership that we enjoy with the government of Uganda, and we applaud the efforts of all those involved in this partnership.
And we've been mobilizing the government. They led us to have a coalition of all ministries so that together each one of us has a role to play. We need health workers, we need power, we need internet, but more importantly, we need local government, because local government is in charge of the health facilities within the districts.
I want to encourage you, because we are working on these challenges, and we do hope that the Ministry of Energy will improve power supply, and the Ministry of ICT will ensure that we have the required connectivity. And of course, human resources for health is being worked on with the Ministry of Public Service. I therefore call upon the district leadership, the chief administrative officers, the DHOs, the planners, the district health teams, as well as health facility in charges, provide the required oversight for proper handling, maintenance, and functionality of these computers. This should also include plans for replacement due to wear and tear to ensure continuity of the digital health system in the health facilities.
On behalf of Leader City, we pledge to ensure that these computers, first, are kept safely, two, they are properly maintained, and three, they will be put to their rightful use.
On behalf of the United States government, we look forward to being part of the continued digitization of the health supply chain system in Uganda and to working with the government of Uganda and with all our other development partners. Over the next 2 to 3 years, USAID will continue to train and mentor healthcare workers so they can effectively implement electronic logistics information management systems. We will also help to make sure that facilities at healthcare level have reliable internet and electricity connections so that healthcare workers can effectively and efficiently use the electronic systems.
Today, on behalf of the government of Uganda, I would like to extend our special appreciation to the government of the United States of America through USAID Uganda, and particularly through the USAID-funded Uganda Strengthening Supply Chain Systems activity, implemented by Management Sciences for Health, Advocates Coalition for Development and Environment, and Uganda Healthcare Federation for their great support to the government by providing these computers and accessories to be distributed to stores, dispensaries, and ART clinics for the health facilities and district stores that lack.